Hello. So what are some unique stressors that healthcare workers experience while coping with COVID-19? Well, first, there are some stressors that are experienced by anyone who's on the front lines of major disasters. And what comes to mind is soldiers in battlefields or first-line responders in disaster zones. And of course, this is something that is experienced by healthcare workers when they work in intensive care units, in emergency rooms, on the front lines of the epidemic. But in addition to these very well described stressors, we have two additional ones specific for healthcare workers: shame and guilt. Unfortunately, medicine, nursing, healthcare in general has developed a culture of duty where it is not okay to ask for help. We are there to help other people, to provide everything that we can, but God forbid we'll ever need our help for ourselves. So no matter how stressed healthcare workers may be, it's unlikely that they are going to seek some psychological support. And that's our responsibility to change the culture, to develop a new culture when we're not only supporting, but we're actually celebrating people asking for help. The second one is guilt. Healthcare workers very often feel guilty. Why am I still healthy when my patients are dying? And guilty towards their co-workers. If I have to be quarantined, then my co-workers are going to have even more work to do. They may actually be at greater risk of infection, exposing themselves to the virus. So what can we do? What can we do to help our healthcare workers? Schonenfeld and colleagues published an article in April 2020 when they outlined quite beautifully 5 requests, as they put it, that healthcare workers have. Hear me, protect me, prepare me, support me, and care for me. First, hear me, listen to my difficulties, listen to my struggles, listen to what I'm going through. Then protect me, provide me with the appropriate equipment, make sure that you minimize the risk that I have of being infected. Then prepare me, give me the training, give me the resources so that I can provide the best possible care I can for my patients, give them the state-of-the-art treatment for their illness, maximizing their chances of surviving and actually doing well. Support me, and that has two parts, a physical part and a psychological one. Support me physically. When my kids are not going to school, they may very well need some childcare services, but also psychologically support me and give me the psychological support so that I can continue doing my work. And finally, care for me, which is a more holistic concept and has to do with truly showing our appreciation and care for our healthcare workers. And even when there is not that much that we can do in a practical sense, we can always have a sense of presence, being there along lines with our healthcare workers, and always be kind.